start with it's called a justice prayer. So let's pray. God, you have given all people one common origin. It is your will that they be gathered together as one family in yourself. Fill the hearts of mankind with the fire of your love and with the desire to ensure justice for all. By sharing the good things you give us, may we secure an equality for all, our brothers and sisters throughout the world. May there be an end to division, an end to strife, and an end to war. May there be a dawning of a truly human society built on love and peace. We ask all this in the name of Jesus, our Lord. Amen. All right. Well, throughout the presentation today, you are very welcome to enter comments and questions in the chat area. And towards the end of the presentation, you'll have an opportunity to get your questions answered, and you can have comments as well. And we will have our next Learn at Lunch in May, and you'll receive notice when the date's decided, and you don't have to register again for that. And today we are very privileged to have Roopa Cantu be our guest speaker today. And she is a South Asian cisgender licensed clinical social worker who uses the pronouns she, her. She received her master's from New York University and has been practicing as a psychotherapist, clinical supervisor, clinical director, and administrator for 13 years. Roopa has 7 years of experience working as an educator and supervisor for pre-licensed therapists. She loves helping her supervisees and clients overcome their challenges, learn great lessons in the process, and achieve their highest potential. The title of today's presentation is Culturally Competent Mental Health Practice with the South Asian Community. And in this discussion, Roopa will be discussing her cultural background and reasons for pursuing work in the mental health field. She'll share about her experiences providing psychotherapy services to members of the South Asian community. She'll share her understanding of the factors related to access and involvement in mental health services, and finally, macro and micro approaches for addressing them. So thank you so much, Roopa, for being here, and it's all yours.
Thank you. Thank you, Dr. Clark, and thank you, Kim, for inviting me here, being open to this topic being presented. Very meaningful to me. I really appreciate it. I first presented on this topic on the Rise Social Work podcast in October. And it took me a minute to have the confidence to be able to circulate it even to my family members, because I was like, oh, the self-judgment stuff that we do, the self-critical, stuff that we do. And I did, I circulated it to my family and then started circulating it to my colleagues and started bringing them in my supervisions. As Dr. Clark, you mentioned, I'm a clinical supervisor as well. And then started to feel great, and better when I started to get feedback that it was informative and enlightening and helpful and personal and vulnerable. And so when I had the opportunity to present on a topic, after speaking with you, Dr. Clark and Cam, decided and ran this kind of idea by you, and you were very pro, me presenting on it. I decided to go ahead and do that, and I'm glad the day has come. The day has come, and now I'm presenting it. So I would like to preface my presentation by saying that I am not an expert on the South Asian community. I am simply a member of the South Asian community and have been my entire life, which is, nearing about my mid-40s. And I've aspired to work with the South Asian community when I was deciding to pursue a master's degree in social work. And since then, I have worked with members of the South Asian community, provided mental health services to them and supervision services to them and such. And so, based on all of this experience that I have, I feel like I have information to present. However, I just wanted to let you all know, by no means am I an expert on the South Asian community. Okay, so I'm going to share my slides. Can everybody see it? Okay, I'm going to assume a yes.
Yes.
Okay, perfect. Thank you. All right. Okay. So my presentation is on, let me move this over. Okay. Okay, great. So my presentation is on cultural competent mental health practice with the South Asian community. As you mentioned, Dr. Clark, I am a licensed clinical social worker. And I'll just go into an introduction on myself, some of which you already mentioned, Dr. Clark. So I identify as an Indian American. My parents are from India. My parents both grew up in India, and through their teens, my mother left India in her late teens after she graduated from college and went to Zambia, Africa. My father, he ended up getting a medical degree in India and then ended up in Africa as well, but he ended up in Tanzania. So, but yes, I consider myself Indian American, Indian again because my parents are from India, and American, I'm an American citizen. Um, more broadly define myself, identify myself as a South Asian. As many of us know, South Asia is comprised of numerous countries, some of which we might be surprised are included in South Asia. But yes, India is one of those countries. So more broadly identify myself as South Asian. As a cisgender female, and heterosexual, I find it incredibly important for me to have respect for a person's gender and sexual orientation. And so I make it a point to mention those when I present or when I identify myself. Pronouns, she, her, also think those are incredibly important for us to be able to respect in others. And so I make it a point to bring up my pronouns and then welcome other people mentioning their pronouns so I identify them correctly. And when I'm assessing my clients, as part of the assessment process and getting to know them, I mean, these are often questions I'll ask my clients, what are your, how do you identify racially, culturally, ethnically, and what gender do you identify with, gender identity, and what sexual orientation do you identify with? And I could do a better job asking people what their pronouns are. But yes, that is something that is a growing area for me because, like I said, I think it's really important to be able to acknowledge people's pronouns and how they are comfortable being referenced. So I had mentioned my parents ended up in Africa. And then my father was in Tanzania and he was working as a physician. My mother finished her college in India and came to Zambia to stay with her parents. My parents had an arranged marriage, and then they shortly, about 11 months later, had me. So I was born in Ndola, Zambia. Um, my grandparents were a crucial part of my upbringing, were my parents. And my father ended up coming to the United States to find a job, actually a hospital that he could work at. And he had to redo his residency in the United States. I will talk about the immigrant kind of experience. But yeah, that's often a part of the immigrant experience for people. They may have a degree in a different country and then come to the US and kind of have to start over in some ways. So my father, anyway, he did secure a slot at a hospital as a doctor, well, based on the status he was in professionally at the time. And then he was able to secure a site to redo his residency. And then he ended up, my mom and I ended up, I believe he went back to Africa and then back to Zambia and then we all came together. But anyway, so it was in 1982 that we all three immigrated to the US. We immigrated to Philadelphia, Pennsylvania. I want to talk a little bit about that. So my mom, was like my primary caretaker. I mean, my father was very busy working, but of course he was also my caretaker. My mom, has discussed with me what her immigrant experience was like as a new immigrant, acculturation and assimilation wise. And I'll kind of get into some of this as well when I talk about the South Asian clients that I've worked with. So she had been accustomed to being around Indians, whether it was in India, whether it was in Zambia, and now we're in a predominantly African American community. My mom did mention she made a lot of wonderful friends. However, it was difficult for her to be around a different racial group and get accustomed to that again when she was so accustomed to being around the Indian community. Did find some Indian friends, and I feel like my parents, notably my mom, has always been really strong in finding an Indian community wherever we've lived. But it's also my understanding, something that's been very important to her to maintain those connections. Um, so yeah, my mom ended up getting a job. I went through my initial years of school, and then we ended up in well, two different places in Philadelphia. I think the first one was in West LA. I'm sorry, West Philly, not West LA, West Philadelphia. And then we moved to another part of Philadelphia and then ended up in New Jersey. And then when I was we drove cross country. And when I was in third grade, we were in Los Angeles for about a year or two and then ended up in Bakersfield, California. And that's where I spent most of my childhood. I grew up in a nuclear family, and I feel like that's important to mention because that was my experience. Both my parents, and then I ended up having two younger siblings who were born in New Jersey. So that's what my family's comprised of. So recovery journey. And I did receive permission from my father to be able to share this information. So I just wanted to make note of that because I wanted to be respectful, and not mention parts of his story publicly that he maybe wasn't comfortable with or wouldn't be comfortable with. My father suffered from depression. He suffered from alcoholism, in treatment for years, for both. My father, I know that there was a struggle with alcoholism and depression. I know that my dad sought support with his depression in psychiatry and therapy, and sought support for his alcoholism via rehab, and eventually Alcoholics Anonymous. And currently my dad has between 25 and 30 years sober. He might actually be at 30 years at this point, actually. Yeah. So, I I grew up in the chaos of having an alcoholic parent. And there were also treated and untreated members of my family who lived with us when we were on the East Coast. And I don't remember any conversation specifically regarding that, mental illness, substance use, issues specifically spoken of. But I was also pretty young, so I may not have comprehended all of that. But I later it was later explained to me that was kind of what was going on, and that explains some of the dysfunction and chaos that I believe I grew up with. Anyway, I was an untreated member of an alcoholic family, noticed some, emotional instability, dysregulation in myself. And my parents actually pointed it out when I was in my teens. And this is after my dad got into recovery. And then my mom actually ended up in Al-Anon, which is a program for family and friends of alcoholics, shortly after my dad, if it, got sober. And that was when I was 14 or 15 years old. And they told me about Alateen. So I went down the journey of attending Alateen meetings, which is for children of alcoholics, catered towards children of alcoholics. And that was really helpful for me. So that was, I think my first um, taste of recovery, really. And then, as the years went on and I realized there were other issues that I needed to deal with, because of the example that my father was for me of seeking treatment. I saw my, when I needed when multiple people kind of referred me to go to get some psychotherapy treatment. I was willing and able to do that because I knew that existed. I do want to point out, I'm going to be touching on stigma of mental health services in the South Asian community. I feel like my dad broke a lot of the stigmas. I'll talk more about this, but it wasn't really, I think part of the reason that the terms mental health issues or, alcoholism or those kinds of things, those kinds of terms were not used in my family growing up, or because I don't think that, I think there was a stigma. I think that there were, I mean, there may have just been a lack of knowledge that those were the issues going on, or a lack of, um, desire to kind of like talk about them or identify them as that, because then, it could be seen as a label, the person could be labeled. Um, and when these terms are not widely used in our families, there isn't a lot of knowledge to back them up or education. And so I think that that was kind of lacking, right? Like the understanding, the acknowledgement of those different issues. And but yet, my father broke tons of barriers, I feel, to access his own services, and was an example for me. And so I feel like I probably had less to no stigma in terms of accessing services. I will say that when I needed to go down the road of accessing psychiatric services, I felt some stigma, but not the other types of recovery that I got and treatment that I got. And so I'm very grateful for my father for being an example. And so anyway, so my recovery journey has involved treatment related to mental health. I've gone down my own journey of working through my alcoholism and a number of other addictions. Ultimately, the personal experience I'm talking about, of witnessing recovery and experiencing my own, um, along with just being on a career journey of figuring out what I wanted to do next. I had been doing some macro social work, community organizing, labor organizing work, and then decided I needed a switch. I wanted to do more micro work. I didn't even know about these terms at the time, but I wanted to work more closely with people one-on-one on their emotional issues, in a more intimate way, and learned, and had experience with therapy personally, as I shared, and I wanted to be a therapist. I did some volunteering at a couple places that confirmed that that's what I wanted to do. I had the option of pursuing an MFT degree or a social work degree, and I decided to pursue a social work degree. And in my personal statement for grad school, I mentioned my father and some of the things I've mentioned so far in this presentation about how he was an inspiration for me, and broke stigmas and in my own family. Um, and then I wanted to work with other members of the Indian American and South Asian community, provide them with access to services, because I felt like access wasn't so widespread in my family due to some of the issues that I've mentioned. And yeah, I got into grad school. I decided to go to New York University at the time. So I been in, I mentioned I grew up in Bakersfield, and then I moved to Northern California for a couple of years for college, and then ended up graduating from UCLA, stayed in LA for a couple more years, and then decided I wanted to switch of city. And so I moved to New York, and wonderful experience. Got to do some work with the South Asian community there, got involved with a nonprofit there, and ultimately it led me to achieve one of my dreams, which was to do work in India. So I made connections with someone who's pretty well known in the global mental health, international mental health field. And he runs an NGO in Goa, India. And so I was able to go there for 6 months, and that was wonderful. And I conducted clinical research with an organization there. We actually developed a peer-delivered CBT intervention for treating perinatal depression. And I was a co-author on that paper, and that was wonderful. We came back, and I got my associate hours in Bakersfield. Didn't get to work too much with the South Asian community there. One of the issues I will say that has served as a bit of a barrier is language. And the fact that I don't speak a South Asian language fluently. I'm currently on an adventure of learning my native Indian language, which is called Telugu, so that I can expose my 3-year-old to it. And I know it's also my mom's dream to, like, carry on the language tradition. So, but anyway, so so continued getting my associate hours, got licensed in 2016, worked in various roles as, like Dr. Clark mentioned, clinician, clinical supervisor, clinical director. Currently, I'm a clinical supervisor and psychotherapist in private practice. I went into private practice in last March. So that's been a wonderful journey as well. And I'll talk more about my services later on. So what are the challenges that I have seen related to people of the South Asian community accessing mental health services? So seeking and continuing treatment. I would like to say that mental health services are more prominent, more available to people, and that has drawn people who may not typically access treatment to access treatment. I'm on a couple of psychotherapy platforms, including Growth Therapy, Alma Therapy. I have a website, a Psychology Today website. I have a personal professional website. And many of the South Asian clients that I have gotten have come through a couple of those different means. So, and when I've asked, what brought you to meet with me? What brought you to access mental health services? I've been told, I just like I needed it. It got to a point where I couldn't I just couldn't solve my problems on my own, and I needed support, or my partner sees a therapist, or my partner is the therapist, or um I was looking, when I decided I wanted to do therapy, I was looking for a South Asian therapist because I felt like they could understand the challenges that I'm experiencing. So those are some of the things that I've been hearing. But regarding continuing therapy, I found there to be some issues there, and some challenges. I feel like some of my clients maybe ended therapy prematurely, before, termination I felt was indicated as their therapist. Some discontinued because they had family obligations, work obligations, and I'll kind of touch on some of those challenges in a little bit. But those kinds of stressors, which kind of um, like, I guess you would say, like, surmounted some, the ability for them to be able to attend regular treatment. I am a therapist who likes to meet with my clients weekly and then kind of move on to less frequently. Some people wanted to start out less frequently, which I feel like, that was what they were able to do, and I respected that. But I do feel like that probably impacted the building of rapport and the later consistency of attending sessions. So that's some of what I've seen regarding the seeking and the continuing of treatment. Sharing the candidness, so sharing openly about feelings. I've noticed some of the clients, like I would say maybe some of the clients that I've had that were recent immigrants, I found that there was a little bit more resistance to sharing. And my perspective and my kind of hunch about that was that they were not accustomed to sharing about these types of things with a stranger, right? Because I, as a stranger, maybe more accustomed to sharing about their personal challenges, feelings with family. Elders, those were the people, traditionally who people would go to for solutions on things that could be, related to mental health or addictions and just personal problems like that, right? Um, and then some of them felt like, they just couldn't get the answers anymore from their family, right? And I had mentioned, they just realized they had to attend, they knew about therapy and that was the route they had to go. So, and I have found with some of my clients who are Indian, kind of Indian Americans, who grew up in the United States or came here when they were very young. There's a little bit more candidness. Some of those clients, I mean, I've had clients of varied age groups, but some of my younger South Asian clients, I feel maybe have been a little bit more candid. So, I mean, no judgment with the candidness piece. I think that it's equal client, equal therapist, when it comes to openness and comfort with sharing feelings. And, I have just as much of a responsibility as a therapist to create that type of environment as maybe I have an expectation that my client will share openly. So yeah, I think, just unfamiliarity with sharing openly with someone new could be cause for um, candidness or maybe less openness. Pursuing integrated treatment. So there have been times that I've recommended to my clients that they pursue psychiatric treatment along with meeting with me. And I have felt on several occasions that my clients have been resistant to that. One client in particular that I had, um, extreme anxiety. So he works in the tech industry in the Bay Area of California, and was in a relationship with a therapist, actually. They're both South Asian, and it was like his anxiety was really affecting his relationship, affecting his work performance. I had recommended medication. He said, no, I'm gonna just deal with this myself. Just, with you and me and using the tools. And he eventually, I eventually had to terminate treatment with him because of his lack of attendance. And that was one of the most difficult situations I've had recently with the client. I really felt like he was getting support and needed support from doing therapy. And, I was just concerned about how things were going to go for him after termination. But yeah, so that's one example of a client who declined a referral to psychiatric treatment. I've had other clients similarly. I think, it's just we often hear about the lack of wanting to take a pill or, to be able to deal with these things. I'd rather just deal with them on my own. I don't want to put extra medication. I don't know in my system. I don't know what the side effects are going to be, which are all legitimate. I just, as a therapist, feel like integrated treatment can be very beneficial, but, and I have had clients, let me just state, I have also had clients, South Asian clients who have been open to referrals to psychiatric treatment. The immigrant experience. So I was talking about my mom's experience of coming to the country, having been accustomed to being around her family, other members of the Indian American community, people she identified with culturally, ethnically, language wise. And I'm going to talk about, religious beliefs and things like that. But, just used to celebrating all the wonderful occasions, cultural and religious occasions together. And now she's in the US, and these are not part of her environment anymore. And, she has to seek it out. And that's what I'm noticing with many of, some of my recent immigrant clients, or even, recent, can be even, 10 years in the country, right? But yeah, expressing issues around difficulty acculturating and assimilating, um, missing their support at their home country, immigration challenges. I have a client who has not been able to see his family for over 5 years, due to just not even getting an interview, to be able to get a visa to go back to India. And this has been devastating for him. He's missed a couple of death anniversaries of his father that he would have wanted to celebrate with his mother. He missed a wedding of a best friend. Just these really important events that they're not able to be a part of. Gender role issues, and I just want to touch on that too. So, um, I've had clients who shared about, um, in their home country or in their current home environment, they have a family member who is kind of expecting them to, as for example, as a woman, to be able to take care of certain aspects of the home, and how their voice, and expectations are even louder than the patient's, the client's spouse, and all the pressures and stressors that come with that, plus trying to get an education, or like I said, kind of redo an education for themselves in the US, and work or not work, and isolation, and these different familial conflict issues, and getting support from their I know I'm speaking specifically about a female at this point, but I think it goes both ways, the pressures and the expectations and the cultural expectations, and still living under some of those, because they have an in-law or parent who lives with them, that kind of thing. So touching on the cultural practices, customs, religious practices. So I mentioned the deferring to elders for support. Um, and related to that, and with my own personal experience, religious practices of praying. My grandma would typically pray to, help ease our challenges with different things, right? Like my family wanted me married by a certain age, and I wasn't married by a certain age. And so my grandma would engage in a lot of prayer around that. And they saw this as a real challenge that I wasn't married by a certain age. And so they would go to the priest and have the priest, kind of give a, how do I say it, like a estimate of when I might get married, and they would heed that. And sometimes that time would pass, right? I didn't get married by, the 3 years or the 2 years. So that was always really interesting to me. But yes, I grew up with a mom and a grandma who were very religious and would pray, regarding the difficulties. I know there was a period of time that I was in when it was my first relationship, and it was a wonderful experience and a difficult experience for me. And later my mom said that there was somewhat of a prophecy that that wasn't going to be a good time of my life. So therefore that was why that relationship was difficult and didn't work out. So yeah, so, I think it's important when working with my clients to be able to also recognize and acknowledge that there's different cultural practices, religious practices that inform their beliefs around mental health services and treatment and candidness and all of those things. I wanted to touch on the cultural competency piece. Um, I particularly enjoyed reading in the Quick Guide for Clinicians by Samsha on the topic of improving cultural competence. So core cultural competencies for counselors and other clinical staff. So cultural competency is more than a discrete skill set or knowledge base. It requires ongoing self-evaluation on the part of the practitioner. Um, so I try to heed these concepts, this particular concept, these concepts. Um, I personally noticed some countertransference come up when I first started as a private practitioner working with South Asian clients. Just based on my own experiences growing up, as a Indian American, a South Asian, around different people of my community, adults, and there were various pressures and various expectations and beliefs, like I've shared, and that were I felt like some were difficult, and maybe traumatic for me. And so going into these conversations with clients and hearing similar experiences that they have or different experiences, I've definitely felt some counter transference come up. So I felt like it was a duty to my, that for me to work through the counter transference. Um, so that piece around the self-evaluation, how important it is to constantly be evaluating our thoughts, our feelings, our tendencies when we hear certain information. How do we typically respond? What's the most appropriate way to respond to our clients? Culturally competent counselors are aware of their own cultural groups and of their values, assumptions, and biases regarding other cultural groups, and they strive to understand how these factors affect their ability to provide culturally effective services. So, again, things that I feel like are so, so important to think about. I think, given our political climate right now, I think there's a lot of assumptions and biases at play, and I think it's important that we do our best as individuals and myself as a practitioner to be able to constantly check my own assumptions and biases and things that could interfere, like I said, with treatment, being fully present, being fully open and accepting. I try to be as teachable as possible. The blank slate, right? When we go to work with our clients, having that blank slate, not making any assumptions, you're South Asian, you're around the same age as me, that you're going to think similarly to me, have similar beliefs and values. And I try not to do that. I try to go in with a completely open mind. And then micro skills. So these are some of the tools that we learn, right? It's like therapy 101, things that we learn in our master's degree program, bachelor's degree programs when we're learning how to work with people in the ways we do. So empathy, very, very important. I do my best to come from that place, putting myself in the shoes of the client, but not making assumptions, right? So making sure that I'm not putting myself in their shoes and making assumptions, but I'm hearing their own unique experiences and doing my best to be as present and supportive as I possibly can. I tell people that like my therapeutic approach is supportive therapy and strength-based therapy, and those are the foundations. And from there, I branch out into doing CBT work and such. But that basic foundation is very, very important. Active listening, actively listening to what the clients are saying, even if my own thoughts and beliefs and preferences are coming up, making sure that I'm paying full attention to my client. Like I said, the building rapport piece from like a strength-based supportive foundation and understanding the client's perspective. What are some macro skills that we can use? Needs assessments. What is going on? What does the community need? I feel like I could continue to do more work in these areas. So what does the community actually need, right? And the way we figure those things out is, we do surveys, we talk to people, we gather information, build community. What are the different ways that we can build community, and how can we train our staff to be able to have the skills that are needed to provide culturally competent care and all the care, with all the micro skills that I just touched on. I currently live in a predominantly Indian community by chance. And I've mentioned, like, I need to conduct my own needs assessment here, like this could be the perfect place for me to do that. And I grew up attending temple and temple events and cultural events and all those things. And I feel like those are perfect and wonderful environments where community is built and where needs can be assessed. Go back to this slide one more time. There's actually a organization in the Bay Area, and they have a specific South Asian behavioral health program. So they bring on doctoral students, they bring on like interns of other licensed interns or pre-licensed interns, and so they're trained, so they get supervision and they provide therapy to members of the South Asian community. I actually attended a conference that was organized by them, and it was really amazing. They touched on many of the topics I did today on work with the South Asian community, challenges, approaches, and things like that. And I've been trying to get my foot in there actually to provide services and maybe even provide supervision to the therapists there. But yes, so all over the country, all over there are amazing organizations and programs like that exist. So my services. So I just wanted to share about some of my services. Let me see if I can do this. Okay. So this is my website. Okay. Hopefully it's showing my website. Okay, there we go. So rupacantu.tribesites.com. And I just, kind of go over all of my services and such here. And if there's an opportunity for me to present or share my website, I would love to do that with the group. And I'm trying to make sure I'm sharing the right stuff. Uh-oh. Let's see. Okay, there we go. And this is my Psychology Today. So if you search Psychology Today, Roopa Cantu, you'd be able to see my Psychology Today website, where I also talk about my psychotherapy and clinical supervision services. I have a clinical supervision flyer, which I would love to circulate. These are about all the services I offer: coaching, licensed supervision, consultation. And then I also present a webinar on how to get from graduation to independent licensure. I've presented it a number of times, and people have found it extremely helpful because we don't always learn about these different steps because during grad school, and it's because there's other things that we focus on in grad school. So, but I do provide this webinar. And when people register, I kind of let them know the upcoming date that I'm going to be presenting. So that's my presentation. Thank you.
Yeah, thank you so much, Rupa. That was wonderful. There are a few questions. I think the first one was written before you got to that section, but I'm going to read it anyways, and there might be something you want to add. but it says, thank you for sharing your EMIC perspective and how that shaped your practice with clients. What skills or tools do you utilize to not bias your approach towards clients' unique experiences and effectively treat them?
Skills and tools to not bias my approach and effectively treat.
Uh-huh.
Okay. That is a good question. Yeah, I did touch on cultural competency. So that's a big, big tool and skill that I use. I mentioned having kind of going in with a blank slate. I am constantly self-assessing. There are actually several therapist and clinical supervisor self-assessment tools out there. So I'd recommend people use them if you kind of fall into any of those categories. But I'm constantly self-assessing myself for any biases and assumptions. And what am I coming into my day with? What were the stressors I had last night? And trying, practicing mindfulness and trying to stay as present in the moment. I think it's also just, I think the self-acceptance and self-compassion pieces of the work we do and of working with people. Yes, if I'm working with someone and some countertransference comes up, not being self-judgmental, just kind of making a note, making sure that I'm consulting. I have a consultant that I work with. And I have colleagues that I consult with as well. And then I have my own personal therapy. So I make sure that I'm utilizing all those different resources as well to kind of, make sure I'm aware of what's going on for me cognitively and emotionally and try my best to keep those things in check and not let them have a detrimental effect on my work with my clients or supervisees.
Thank you. So you emphasize the importance of religion and spirituality in your clients' lives and their culture. Can you provide explicit examples of how you ethically integrate spiritual practices so that students can see how that may look like in practice?
Yeah, that's a really good question. I could probably do more in this area. When I do my assessments, I do touch on religion and spirituality and things like that. Um, I ask if they're religious, and if so, what, and I feel like I could probably do a better job with asking them the role of religion in their lives, faith, religion, spirituality. Um, Ask them if they feel like it's a source of strength for them or a resource that they can use during difficult times. And I think that probably goes back to the self-assessment piece. I will say the recovery that I have engaged in my life has had elements of religion and spirituality. So I definitely believe there's a strong place for that. And so I think one thing I didn't talk about that much is self-disclosure, which I do use as a tool. So, I think I could probably do more with self-disclosing about the fact that that I do, this is where I stand religiously and such. And it's been a source of strength for me and taken me through my own recovery and, kind of asking them and, what place it's held for them. Again, I think I could probably do a lot more in those different areas.
Thank you. Have you, oh, hold on a second. How have you navigated systems or agencies that don't provide culturally relevant services or interventions for ethnic groups? How have you gone about to promote culturally relevant treatment for specialized groups?
It's a really, really good question. Self-disclosure here, I feel like I've worked in a lot of places that don't um, honor cultural diversity and cultural competency. Not too much diversity at the administrative level. And I've been an administrator and felt like I was probably the the token diversity person, administrator of that company. And And this is despite the fact that there's mention of the fact that, they promote cultural diversity and inclusion and things like that. So when I've had the opportunity to express my feelings about these things, I have. I'm much better now than how I was early on in my professional life. And recently, I guess it would be a year ago now, I left an agency after trying several times to work with the director, like collaborate on being able to bring in some like diverse initiatives. And they decided they wanted to make a decision on when and how those were going to be pursued themselves. And so, yeah, I after just various efforts, I ended up having to leave. One of the main reasons I'm in private practice right now is because I have not, it's been difficult for me to find the environment that I feel really honors my own diversity, like my own, identity, as well as those of others. So that's been a challenge when where I've had the opportunity to really work on that has been with my clients in the ways that I've mentioned, addressing the different topics, and then in my own clinical supervision, in my just all the supervision services I provide, I make sure that that is a topic that's brought up, that we each are talking about, our identities and different aspects of our identity, including culture that play a role.
All right, it looks like we have one last question. There was an opportunity you mentioned you had in New York with being co-author. Do you mind repeating that information, and how impactful has it been in your current endeavors?
Yeah, so when I was in New York, I attended a talk, and the particular speaker, he was the founder of an NGO in India that I ended up working for. So it was actually an opportunity in India, but yes, I got it when I through connections that I made when I was in New York. It was incredibly impactful. I got to work in India, which was a dream of mine for so many years. I got to do work in the field I had been trained in. So I was able to do clinical work. It was clinical research. It was an area that I wanted to delve into research. I had been doing some practice up until then. And just being, and it was also, like I said, or I didn't say, but it was uncomfortable, because I didn't have the language abilities. But it was, and the discomfort around that was wonderful because I got to, despite that, show up at these different homes and community events and work with people in a really wonderful way, and then develop the research skills. And CBT is one of the main modalities I use, and so it was wonderful to get some training in that.
Awesome. Well, I don't see any other questions coming in.
I think there were some about the webinars and such. Is that right?
Yeah, I was trying to figure out what she meant by that.
Oh, the
just
one that I offer, I think.
okay.
Oh, okay. Yeah, I mean, is there a way, Kim, for me to get to circulate kind of my flyer or in my websites and then the webinar flyer?
Um, yeah, we probably could put that into our resource page for our students. Yeah,
Okay, that would be perfect.
if there's a way, if you want to, you could drop it into the chat here too.
Oh, yeah, maybe do that.
Well, thank you so much for sharing today, and I think culturally relevant practice and competency and humility, like I like to call it too, as well, is so important these days, especially these days, in really recognizing and understanding and appreciating people's life stories and experiences and valuing that and not downplaying that, you know. And so I think that as social workers and as educators and people that are working with different populations, you know, we have to really be aware of those things and really fight for those things, you know, for valuing people's stories and experiences.
Yeah, so if you look in the chat, Rupa has added her information, links for you to take a look at. We will be hosting another Learn at Lunch in May, and we'll be sending out information on the topic as we get closer. If you have any questions about Learn at Lunch, feel free to reach out to me or Dr. Clark. And thank you again for Rupa for your time and your great presentation, and for everyone else for attending today.
Thank you, everybody.
Thank you, everybody, for attending.
Mhm.
Is there a way for me to access the recording, or is that internal? Is that
No, I think I can give you a link. Mhm.
Yeah. Okay. That would be
Yeah,
wonderful.
we do not have a survey site.
Okay.
Thank you, everybody.
Mhm.
Thank you, Rupa. That was awesome.